Today's physio hack is super duper important. I'm talking about the one word you never say to patients, ever. You just don't say it. You're gonna wanna say it, it's on your mind, you're gonna wanna say it, but don't say it. That's coming up on today's physio hacker. Okay, so what is the one word you never tell patients? The one word. When you say this word, the very first thing they're going to do is freak out. I'm telling you, they freak out in their own head. Nothing that you say after this point is really clinically meaningful because all they're going to be thinking about is this one word. So what is it? It's the word surgery. And the reason you say never say the word surgery, because the moment you say it, this is what they think, right here. A bunch of physicians leaning over them, ready to cut their shoulder open. And the reason is that one word already has a place in their head. It's not blank, it's written on. And what's written on that place is everything that they saw from everybody before them that's had surgery, especially their surgery. So if they have a shoulder problem, when Aunt May had a shoulder problem and she had surgery, Aunt May's shoulder was never the same. When Uncle Bob had surgery for his shoulder, it hurt constantly. He had 6 months of rehab. It was a mess. So if you say the word surgery, the very first thing that patient's gonna do is recall in their head all the people that had surgery. And guess what they say next? So do you think this is the kind of problem that's gonna require surgery? What if physical therapy doesn't work? Am I gonna need surgery? Well, do you have any surgeons in mind? Should I get an MRI? Those are the questions that follow. The moment you say the word surgery, even if you said to them, because this is what most of you say, right? This is what you say. I don't think this is the kind of problem that's gonna require surgery. Surgery, don't say the word. You wanna tell them it doesn't require surgery, but never use the word surgery. So what do you do instead? You would say something like this. I think this is the kind of thing that you and I can resolve by working together. But that's it. I think that we can get this all better just with physical therapy. But that's it. Just keep the word surgery out of it. Because if you keep the word surgery out of it, you keep that clean slate. When do you say the word surgery? When you think they're gonna need surgery. When you get to that point in physical therapy where you're like, damn it, this is not getting any better. You've done everything possible. You've looked at the evidence, you're doing your thing, the whole thing, and they're not any better. Then you say to them, I think that we might need to get you over to whoever, a physician, an MD, an orthopod that you recommend, to get an MRI to see if this is the kind of thing that may need to move on to the next level. Even then I don't say surgery. And they say, well, what do you mean by next level? And I follow it up with, well, an MRI, maybe an injection, and potentially, if none of that is helpful, then surgery might be an option down the road. But guess what? I never mention it until I'm almost positive they need it. Otherwise, that's all they're gonna be thinking about. Fear drives everything after that. That conversation, the whole rehab, they're just thinking to themselves, what if I need surgery? So that is today's physio hack, and that's a really important one. Implement that. Implement that when you get back. See if you can avoid that word completely. All right, once again, my name is Dr. Jared Cooper. I am the physio hacker. Check me out on the book, on the tube, on the gram. We'll see you guys next time, and make sure to head over to physiohacker.com for more awesome videos.